Well, neurosurgery is the surgical treatment specialty involving disorders of the brain, spine, spinal cord, and peripheral nerves. And here we do have a full-service neurosurgery center where we can be involved with trauma, with tumors, with degenerative processes. Most commonly, what we see relate to degenerative changes and injuries in the spine. And then treatment can include non-surgical treatment, as well as the potential for removal of herniated discs, fusions of the spine, and numerous types of surgical problems that we can deal with. Well, in many cases, we're dealing with pain. When there's an injury to the spine, there can be pressure on the nerve structures, leading to pain in the distribution of that nerve, and that pain can be incapacitating. And in some situations, surgery can be the only means of relieving that kind of pain. In other circumstances, it may be trying to deal with loss of nerve function. In a case where there is pressure on the spinal cord, for example, there may be weakness or paralysis, difficulty controlling bowel or bladder function, and these can be very serious situations that require surgical treatment for correction. In the Orthopedic and Neurosciences Center, we have a broad range of physicians and ancillary services available to our patients, so that if a person comes into the center and sees a surgeon but really does not need surgery, then that person can still be treated here in the center by other physicians and other services. We have physical therapy, we have physical medicine, and pain management and orthopedic surgery, in addition to neurosurgery right here in the center. In addition, we have capabilities for diagnostic studies. If you come and see me in my office, we need an x-ray right away and come back to the office. You just go one floor up and get the x-ray and come right back. And so it's really quite easy and is very helpful, I think, to the patients to have all of those services in one area. We're developing a program where patients can be referred to the center, so that if a person has back pain or neck pain or radiating pain into the arm or leg, but is not clear at that stage whether that person needs a surgeon or needs a physical medicine specialist or a sports medicine specialist, then that person could be referred to the center. And at the center, we can review the diagnostic studies and determine where the best starting point would be for that person. And that way, the burden of determination is not back on the primary care physician. And if it turns out that a person sees one physician and subsequently needs to see a different physician, that can all be done right here in the center. So there's a very nice continuity of care, and it's very easy for us to collaborate with each other. If the pain management doctor needs to talk to me, he's right here.